We have a presentation here regarding a study that we've been working on over the last year and a half, couple years. It's a it started as a phase 1 dose escalation and then went into a phase 1B, somewhat of phase 2 study, close to 70 patients, 72 patients. The combination actually included the standard of care chemotherapy, gemcitabine and Nab-Paclitaxel, and we added to that an agent called Napabucasin, or BBI 608. And that's an interesting compound. That's a compound that is, hypothetically at least, affects the stemness of cancer cells. So, we have these cancer cells that are either incredibly resistant to chemotherapy, radiation, or any other therapies because they're so stubborn. And those cells acquire these stem-like features. What we also have been understanding more is that even cancer cells that are not stem cells or have stemness features under pressure can revert back to become stem cells. And we've never had a way to target those agents and now, or those cells. So this agent actually targets pathways that I think are relevant for stemness and stem cell. And also this agent seems to synergize really well with chemotherapy, specifically taxanes and somewhat gemcitabine. And so this was the rationale to build this trial in pancreas cancer. The phase 1B, so the expansion study with close to 70 patients, we had a response rate of 55%. So in pancreas cancer, a response rate of 55% is something we don't see every day, including 2 CR patients. So 2 patients with solid CRs that continues, at least for 1 patient, that CR continues to go on for now a few months. So when we look at these results, and then we looked at the PFS, we don't have the full PFS and the OS yet because we're still analyzing some of that data, but all the numbers look really favorable, getting closer to the year, actually perhaps a little bit more than a year with the overall survival. All these very encouraging signals are actually took us to with a company that owns the compound to essentially build that clinical trial. Phase 3 trial. It's an international trial that Boston Biomedical is essentially sponsoring. It's 1,200 plus patients, so it's a large trial, probably the largest trial in metastatic pancreas cancer, and it's randomizing patients to gemcitabine, Nab-Paclitaxel, plus minus Napabucasin. Very simple design, powered for survival. We have essentially multiple stop points at 200 patients as the first stop point. So we're hoping that we can hit our primary endpoint even earlier, but we'll see. I mean, the study is ongoing, started in few sites around the world, and is starting also to accrue within the US. And when we look at our phase 1B data, and we hope that these translate into somewhat similar phase 3 data, I think this will end up being a game changer.